somewhere along the line they get abused and overused very quickly, and then it's just downhill from there.
Well, like alcohol, there's abuse addiction genes. We don't know who's more susceptible to become addicted to these substances, but it can happen very readily. And is that a good trade-off? Is it reasonable to give that risk profile just to get back on the field? Why not let them rest an extra week or two?
Now, a lot of players, and you see Kyle Turley, there are others as well, who say marijuana either gets them off the opioids or they could lessen their use of it, reduce their use of it. As a doctor, what is your position?
Well, I'm not so much pro-marijuana. I'm kind of anti-all drugs, but I think that it is probably almost equally effective and probably a safer side effect profile than opioids. And, I think it's definitely something to consider. We haven't done great medical studies on it, so there's still a lot of questions.
Well, currently the NFL tests for marijuana in general, and after 4 games, they'll suspend you 4 times straight, and then you're out. Or there are consequences, but at this point they're willing to review and look into marijuana. Do you think that's a good idea?
Well, I think that it is a good idea. I always wonder, do we really care if the safety for the New Orleans Saints or the center fielder for the Cubs is on marijuana? I mean, I'm concerned if our bus drivers and our doctors and our airline pilots and our politicians, we should check them for drugs. Where did we get off on checking athletes?
Who get in the car and drive? Someone can argue, well, they're going to drive to the game, they're going to drive away from the game, and let's say they're using marijuana, or they're playing while they're using marijuana. Does that matter?
Well, I think it does matter if we show that it really affects your driving ability and you're under the influence. But I think we need to take a step back and go, where did it start that we're testing athletes and we know more about athletes than Hillary Clinton and Donald Trump? We don't know very little about their health. We know more about the quarterback in the game last night between the Texans and the Raiders than we do about key people that affect our lives.
To some weird extent, Doctor, it's because we care more about the quarterback. But let me get specifically to this. Marijuana, part of it is, my take has always been it's cultural. If marijuana had been around and alcohol wasn't, alcohol might be in the position that marijuana is in at this point. If you take away the cultural taboo on marijuana, where do you think we would be?
I think there's no question that alcohol and opioids are a far greater danger and offer less relative benefit than does marijuana. But again, I'd like to take a step back and say, do we really need drugs at all? And while I voted for the legalization of marijuana because I don't think it should be illegal, I still think all the tax revenue we make should be educating kids not to use it. I still don't believe in it, but it should be illegal.
If I'm your patient and I'm an athlete and I'm in pain, what are you going to tell me?
Well, I'm going to tell you, first of all, should you be back on the field with an ankle or a knee injury?
Got to be. I only have 16 games. I have to be.
But I'd rather have you walk with your kids in the next 20 years than complete those 16 games.
He should be our doctor. Okay. Dr. Rob Huizenga, thank you so much.
Thank
Great
you.
to see you.